Okay, now let's start with pulmonary embolism. It is a condition there is blockage in one of the pulmonary arteries in the lungs, usually caused by a blood clot that travels to the lungs from the legs or other parts of the body, like deep vein thrombosis. This condition can be life-threatening if it is not treated on time. Patient with DVT, prolonged immobilization, surgery, obesity, pregnancy, heart disease, and history of thromboembolism are the risk factors for pulmonary embolism. The signs and symptoms can vary depending upon your lung involvement, the size of clots, and whether you have underlying lung or heart disease. Shortness of breath, chest pain, and cough are the main symptoms. The treatment also depends on the size and location of blood clots. Anticoagulants and thrombolytic agents are used. Now let's go on the nursing interventions, which is also the most important part for your NCLEX exam. Rapid nursing management are needed. We need to calm the patient and head elevation is necessary. They need notify to the rapid response team or primary healthcare provider. We need to provide oxygen as per needed. We need to check the vital signs, ABG analysis or lab tests are also needed. Long sound assessment like crackles may present in this condition. Pain management is also necessary. For the medical management, we start heparin therapy as per doctor order, like blood thinners or thrombolytic agents. Plus, patient comfort support is also necessary in this case. And final, we do documentation of all the intervention we have done. The next topic is ARDS, acute respiratory distress syndrome, which is type of a respiratory failure which occurs when the capillary membrane that surrounds the alveoli sac becomes damaged, which causes fluid leak into the alveoli sac. The risk is among the patients who are already sick. It develops as a complications from the conditions like sepsis, burn, other health issues like pancreatitis, pneumonia, aspiration. For the NCLEX tip, you have to know the hallmark sign of ARDS, which is refractory hypoxemia. In this condition, the patient will maintain a low oxygen level even though they are receiving high amount of oxygen. For the nursing management, we need to maintain the patient airway for the respiratory function. Patient with ARDS needs mechanical ventilation with PEEP. Patient will need high amount of PEEP because of the collapsed sac, suffering of the lungs and pulmonary edema, and the high amount of pressure will open the sac and improve the gas exchange. The positioning is also important. We provide prone position. We assess the lung sound. Suctioning is also necessary as there is increased level of secretions. We need to provide medication as per doctor order like corticosteroids and antibiotics. Now let's go on epiglottitis, which is the inflammation of epiglottis which can lead to an upper airway obstruction, and it is the emergency condition and urgent intervention is needed. The causative agent is a bacteria named as Haemophilus influenza type B. The signs and symptoms are sore throat, which is painful, breathing difficulties, swollen epiglottis on X-ray, drooling, tripod position, where patient leans forward with mouth open, and the tongue may be sticking out, and fever plus dysphagia are also the signs and symptoms of epiglottitis. Now let's go on nursing interventions. For the NCLEX tip, you have to know that in case of epiglottitis, we do not insert anything inside the patient's mouth. Maintaining airway is priority. Most patients with severe cases of epiglottitis will need to be intubated or tracheostomy may be needed. Always keep the emergency equipment at bedside and have trained staff readily available for possible intubation. Allow the child to be in comfortable position that allows them to breathe. Assess for respiratory efforts. Listen for lung sound and cyanosis. Assess for vitals and mental status. Provide a calm environment. As per doctor order, we need to provide IV antibiotic, corticosteroids, antipyretic or IV fluids as per needed. For the prevention, HIV vaccine is required. Now let's go on obstructive sleep apnea OSA, which it is the condition in which breathing stops involuntarily for a brief period of time during sleep. Due to the partial or complete obstruction, patient experiences apnea during the sleep, and hypoxia and hypercapnia occurs, which may stimulate client to arouse. The risk factors are large tonsils, thick neck, obesity, age. It is more common in older adults, more common in men than female. Genetic is also the risk factor for sleep apnea. Alcohol and sedative users, diabetes, hypothyroidism, heart disease, etc. Now the signs and symptoms are loud snoring, abrupt awakening, morning headache, difficult in concentration, high BP, excessive daytime sleepiness, and there is frequent arousal with sleep occurs, not difficult arousal. In mild cases, OSA is managed with lifestyle changes like weight loss, regular exercise, cessation of smoking and alcohol, avoiding sedative medication during sleep. But in severe case, it is managed with positive airway pressures like CPAP or BiPAP, which helps to reduce the respiratory events that occur as you sleep, reduces the daytime sleepiness, and improves the quality of life. Now let's go on the laryngotracheobronchitis, which is also known as CROP. CROP is a common childhood viral infection of larynx, trachea, and bronchial tubes, which is caused by the viral infections like parainfluenza viruses, adenovirus, respiratory syncytial virus, and measles. It is also caused by allergies, exposure to inhaled irritants, or bacterial infections. The signs and symptoms are fever, difficulty in swallowing or drooling, sneezing or runny nose, barking cough, stridor, cyanosis. There is no cure for cough, but there are many treatments that can help improve the symptoms. Maintaining child's airway using steroids to open the child's airway, allowing for easier breathing. In case of bacterial infection, we use antibiotics, adequate hydration with IV fluids, and in severe cases, intubation might be needed. The next topic is pleural effusion, fluid collection between the pleural space. Pulmonary embolism, blockage in the lung arteries, congestive heart failure, liver cirrhosis, complications from open heart surgery, pneumonia, severe kidney disease, autoimmune disease like lupus can lead to a pleural effusion. The common signs symptoms are chest pain, dry cough, fever, difficult breathing when lying down, shortness of breath, difficult taking deep breaths, persistent hip cough, difficulty with physical activity. The underlying cause of the condition and the severity of the effusion will determine the treatment. Generally, the treatment involves draining the fluid from the chest cavity either with a needle or a small tube injection into the chest or thoracocentesis. In case of repeated fluid buildup in between the pleural cavity, the pleurodesis procedure is done, which causes pleural layer to stick together, which has to prevent future buildup of a fluid between both layers. And other supportive nursing managements are oxygen therapy, semi or high forward position, pain management, infection control, medication therapy like diuretics, and monitoring for fluid overload or other complications. Thank you for watching. Do subscribe for next video.